All right, we can get started. Hello, everyone. Thank you for joining us for the Foothill College COVID Vaccine Education Series presented by the STEM Division and Science Learning Institute. My name is Ram Subramaniam. I serve as the Dean of the STEM Division at Foothill College. This is the fourth of our four-part series to learn about different aspects of the COVID vaccine. We learned about the biology, the public health information, and myths around the vaccine. Today, we will hear from our Santa Clara County expert about vaccinating our residents of the community. Sophia Kim, Rebecca Ryan, Diane DeNagel, and Sarah Cooper are the co-organizers of this program. I am now going to hand over to Sophia Kim, who will go over some of the logistics regarding this webinar.
Thanks, Ram. Ram, if you could keep an eye out in the attendee for Dr. Villarino. Hi, everybody. I'm Sophia, the director of the Science Learning Institute, and I'll just share a little bit about logistics of today. As you'll notice, we've disabled the chat box to limit distractions for participants and for our speaker who will be sharing slides. However, you will be able to use the Q&A box, which is at the bottom of your screen. You can feel free to add the questions as they come, but I believe we'll be having a Q&A session at the end with Dr. Villarino, so we won't be answering questions right away, but if you have questions, feel free to put them in the chat, in the Q&A box. You're also able to upvote any questions, so if you don't want to repeat yourself and a question has already been asked that you care about, please feel free to use that. The webinar will be recorded and posted at the COVID Education Series website, so please look out for that by the end of the week. And finally, we have our ASL interpreters with us today, so we'll have their screens up for view for those who require the interpretation. Back to you, Rob.
Thank you, Sophia. We're still waiting for our speaker today, but I'm going to start introducing our speaker. It is with great pleasure and honor that I introduce today's speaker of this education series. Speaking to us about encouraging COVID-19 vaccination through culturally competent, evidence-based approach is Dr. Elsa Villarino. Dr. Elsa Villarino is the County of Santa Clara Public Health Department's tuberculosis controller and is an assistant health officer for the department. She serves in the Infectious Disease Response Branch, leading efforts to investigate tuberculosis cases and outbreaks, to stop their spread and to prevent disease spread in the community. Dr. Villarino also serves as the director of the Special Investigations Branch for COVID-19 response, facilitating the development of infection prevention and control for COVID-19 in healthcare facilities. As director, she oversees implementation of measures in healthcare facilities to prevent the spread of COVID-19, including working with stakeholders at these hospitals and long-term care facilities to support infection control. Prior to joining the Santa Clara County, she was a medical epidemiologist with the U.S. Center for Disease Control and Prevention in the Division of Tuberculosis Elimination, where she was the lead of the TB Clinical Trials Consortium. While at CDC, Dr. Villarino also worked in the National Center for Emerging and Zoonotic Infectious Diseases, Division of Global Migration and Quarantine, as the County Officer Director for Mexico and the Liaison for Ministry of Health in Mexico from 2013 to 2019. Dr. Villarino earned her MD in Autonomous University of Baja, California, and received a Master's of Public Health from San Diego State University, Graduate School of Public Health. She's a member of the American Board of Preventive Medicine. Please join me in welcoming Dr. Elsa Villarino.
Thank you very much. I was a few minutes late joining, just finishing another assignment, but I'm so happy to be here representing Santa Clara County Public Health Department and our health officer, Dr. Sarah Cody, but also personally as somebody who's been working on the COVID response since January of last year. Almost impossible to think, and trying to do my part, not only from the public health department, but also as a member of the community and as a member of the Hispanic community in Santa Clara County. So I think we should start, if that's okay with you. And we will go along. I hope that you find the presentation enlightening and that you have a lot of questions for me. I always find that really the best way of teaching and delivering a message is through questions. And I always learn a lot from my audience. I hope that I'm clear in what I'm going to be presenting. Like they say, is not rocket science, but it is actually very difficult work that we all need to do together. So I'm going to be talking about how we can encourage COVID-19 vaccination in a way that is culturally competent and that is based on evidence. The next one, please. So this is the epidemic, the worst part of the epidemic in Santa Clara County. It is a line graph. It is presented from November of 2020 until January of 2025. For those familiar with line graphs, you can tell that the higher you are on the y-axis, the more cases you have. So the green line, where the rate reached over 150 per 100,000, that belongs to the Hispanics group in Santa Clara County, was achieved at the very peak of our epidemic in early January of 2021. There's always been disparities in the number of cases by race ethnicity from the very beginning of our when we started counting cases. Our first case in Santa Clara County that we thought happened was on a case diagnosed January 27, 2020 in a returning traveler that came from Wuhan. But we soon learned that that case wasn't the first case, when on February 6th, a woman that died of COVID was also diagnosed after coroner and other examination of the death. So in April, we knew that somebody who died on February 6th was only the tip of an iceberg of an epidemic that was already happening since at least January 2020, and much likely before, since December. Can we go to the next slide? So this graph doesn't represent the whole year since January of 2020, rather focuses on the peak. You might have heard about waves and the first wave and the second wave. Well, the first wave was when we first learned how many cases they were really facing because we had testing available. So that came in February, March, in the spring of 2020. And then we had another peak in the summer, July, August, that we thought was much worse than the first one, but really didn't prepare us for what we were about to face starting November. There were many reasons for this: the winter coming, people coming indoors, pandemic recommendation fatigue, congregation, all the things that are not good for stopping transmission. We all didn't have a vaccine yet, and the number of cases just got so high in our county that the probability of meeting somebody in an opportune time to transmit an infection was very high for any of us. But when I say any of us, well, you know, again, not for all of us, because if we look at it by race ethnicity, it is the Latinx or Hispanic Latino community that had the most cases, compared to Asian and white Santa Clara County residents. And I have to caution that the orange line for the African Americans is always difficult to interpret because the denominator is so small in our county. In our county, really, we could think globally that we're 30, 30, 30 for Hispanic, Asians, and whites. And the African American represents a very small proportion. And for that reason, when you have a very small denominator, the changes in the numerator number of cases may appear higher than what they are, or really not interpretable for the purpose of statistics. But you can see on the right hand of the line graph how we've been doing much better since April, really since like the middle of January. The cases in all of our county residents, no matter what race, ethnicity, started going down. But again, some went down faster because they came from higher, such as the green line. Orange line, difficult to interpret. And the ones that were lower to begin with got lower. And this is vaccination became available in our county on December 18. It started for healthcare workers and for elderly over 65, especially the ones that live in congregate settings. But the change in the numbers of cases really became significant then later in February and March. The next one, please. So this is how we're doing nationwide in terms of vaccination. If you would recall, President Biden promised 100 million vaccines delivered in his first 100 days in office. He achieved that goal, the federal government, by 58 days after. But we're still lagging behind because in the United States, the percent of people that have at least one dose is 45%, and fully vaccinated, which means that you have the whole series or 2 doses, is only 33% as of May the 7th of this year. So that's still falling short of the hope that the more vaccinated people that we have, and combining that with people that have been infected with COVID in the past and therefore have a natural immunity already, would become the ones that would get us over the age by becoming part of what is known as herd immunity. Herd immunity is when a population, a group of people as big as a whole nation, or as a state as large as California, or a county like Santa Clara County, has enough people who are no longer susceptible to the disease. Because if you're no longer susceptible to the disease, you cannot transmit the disease to others and you break the chain of transmission. This only happens when we have enough people that are vaccinated or have already had the infection. And therefore, if they were to get infected again, either post-vaccination or after an infection, they usually get a very mild case and normally not able to be transmitted to another person. The next one. But how are we doing in Santa Clara, and where are we going with vaccination? Let's remember what our population is, almost 2 million people. And for purposes of some of the numbers I will show you, the 16 and older population is of importance because right now the vaccinations are only approved for age 16 and above, although we're working on getting those to younger children. So the county had put an ambitious goal of vaccinating 85% of the population eligible to receive vaccination. That's the ones that are 16 and over. And let's see how we're doing if we go to the next one. We're going to start off on how we're trying to achieve the goal. I already mentioned that the very first target of vaccination were the elderly and the healthcare workers. In this talk, I'm not going to discuss about healthcare workers because getting those people vaccinated, it's a very concerted effort by the medical systems that employ them. With the exception of the healthcare workers that work in the congregate settings or long-term care facilities, where usually they are many, they are of perhaps CNAs, a few RNs, but less physicians and other groups that would be employed by a medical system. So they're normally employees or contracted by the long-term care facilities, and they themselves sometimes are in an older age group and still working in a very service-oriented, high-touch, high risk for tuberculosis, for COVID disease population. But the other aspect of the elderly is that some of them live in congregate settings where the transmission of disease is much easier to happen because, as you know, COVID is something that gets transmitted when people speak or cough or sneeze and infect the air and somebody else breathes it in. Also through touch, although less. And whenever you have an airborne disease that is transmitted easily, like COVID is, it is very hard to provide the proper precautions just with personal protective equipment, like the face mask and the face shields, and simply it gets to be a formidable task that is not easily preventable. So this is the number of elderly, and I say elderly, and I'm getting close to the 65 and older, but so of older, of older Santa Clara County residents, 65 and older are more than 300,000, and 75 and older more than 130,000. They are over 50% in the older age groups are white, non-Hispanic, which is different than the curve of race ethnicity that I was mentioning before, where if you take the county as a whole with all the young people, then white Hispanics are no more than 30%. African American, you can see very little, 2.1%. And then Asians, 30%, right? The same as if you take the whole population. And Hispanics, they're elder Hispanics, not that many, either because we are more recent immigrants or maybe we're undercounted in the census, or also maybe we can't afford to live within the borders of Santa Clara County, where it's so expensive. And some people that work in Santa Clara County live outside for being able to afford housing. Males and females, about half and half, although females live longer and there are more females in the elder groups. The next one. So to get to the elders, and then we needed to think, how can we do it? What elements of a vaccine program would be needed, because we have never in the county launched a massive vaccination campaign like the one for COVID. A lot of people that worked here in 2009 remembered H1N1, which used to be called the flu, the swine flu, the all kinds of other names that H1N1 had until it settled in the proper name for the virus. But when vaccination came for that episode of disease, which was also a pandemic, but a pandemic that affected much less people, that had much lower mortality, and that by the time a vaccine came, most people had already been infected if they were going to be infected and survived. So there was a lot of natural immunity. COVID-19, not the same thing. The vaccine was developed in record speed thanks to great scientific advances, where you can take messenger RNA, which is done as a copy of the DNA of the virus, and you can basically convert it into a vaccine. That what it does is teach the immune system of the person that you inject with a vaccine to be able to recognize the coronavirus when it comes in and make antibodies so that you can fight off the infection. It doesn't protect you completely from having coronavirus 19 disease or COVID-19, but it does makes you more able to withstand it and even not die from the disease because your immunity kicks in and helps fight it. Well, for anything to work, any intervention to work, you have to get it into people. And for that, you have to create clinics or delivery systems that get to all the communities, not just the easy to reach communities. And then we knew that we had a big task ahead of us because there were many instances of between misinformation to other hesitancies that people had about the vaccine, yet we knew we had to roll it out fast. Can we go to the next one?
Dr. Villarino,
Mm-hmm.
there are some questions. Do you want to wait till the end to take
Yes,
the
I
questions?
think we should wait till the end if that's okay with you.
Yes, whatever you prefer. Yes, we'll
Okay.
wait.
Yes, thank you. So the sites that are available in Santa Clara, then where there was a collection of information from the community, like you saw, statistics, like how many elderly do we have? Where do they live? Do they live at home or do they live in congregate settings? Could they come to a vaccine site? Could somebody bring them? Do we need to go to them? Do they need an appointment, and who can help them make an appointment if they are not internet savvy? What about having clinics that you can just walk up with no appointment, and even moving them to different areas where we know people were there. So there would be a matter of strategically locating the clinics. And the next one. And then who could we engage so that the clinics were noticed, so that we knew that so that the people that needed to use the clinics were aware of where they were in Santa Clara, how can you reach them? And most importantly, were you going to be able to talk to somebody who spoke your language and was part of your same race, ethnicity, cultural group, so that you can get your questions answered and try to do your part about showing up to the vaccination clinics and having confidence that somebody's going to be able to take care of you, answer all the questions that you have, and be able to walk you through the consent form. And so Santa Clara engaged early with the community health and business and team and used the help of trained community healthcare workers to individually engage our community members and businesses. And those are some of the examples. The Colectivo Si Se Puede, the Roots Clinic, the Nueva Vida Community Health Partnerships, and the Fair Workplace Collaborative. Can we go to the next one? So this outreach that was done through the Community Health and Business Engagement, or CHBET, was our early and best effort to incorporate vaccine education, to promote the location of the sites, and to get people registered for vaccine, either before they come to the site and at the vaccine sites. We basically had to train the health workers in Spanish and English so that they would be able to address questions that they would get on vaccine safety, efficacy, and also get them vaccinated, the health workers. The next one, we did, the team members were assigned to either community or businesses, and then to educate about COVID. We focused on efforts on the high-risk zip codes where the most cases of COVID had happened and have continued to happen. In businesses, we included the restaurant workers, the grocery workers, small retailers, childcare workers, very important, and other food and agricultural workers. The next one. We also, some of you might have gotten a call at some time during the last year from the Public Health Department from an activity called case investigation and contact tracing. This is where when the health department knows that somebody has a positive test for COVID-19, then it gets assigned to a contact tracer, and this person calls the person directly to offer all the services that the person might need for conducting proper isolation at home, staying home from work, sometimes even food or rent assistance, or separating them from their family into a safe hotel or some others where it would be safe to do your isolation. And if you were very sick, to get yourself to medical care or to the hospital. This same contact tracers then became the promoters for vaccination. So all the people that they call about contact tracing and how many people were exposed as a result of a case or multiple cases, in the case of little outbreaks that happen in families or big ones that happen in childcare centers and things like that. So they became educators, our contact tracers. We also have 30 people full-time assigned to the resource center, which provides COVID assistance in navigation of in the online processes for registration for vaccination. We also partner with Santa Clara Family Health Plan to direct call individuals 65 and older and medical members through phone calls to offer the vaccine and get them registered for it. And then we also had vaccine stakeholder group partners that added to making the calls. The next one, please. The additional strategies, like I said, was the vaccine stakeholder group, but we also had an ambassador program to disseminate the information through the networks. This included churches and other groups that get together through common goals and to disseminate information like that. We work with partners and county departments to incorporate within our counties, for example, for the unhoused population, for the jailed in custody population, for the workers in those locations, what do they needed to know about vaccine, and when were they going to get it, and why is it important that we all get vaccinated. We held several town hall type meetings with community dialogues, and then we sent out through the mail, direct mailers in different languages to the households. The next one. we prioritize vaccine appointments to give equity to vaccination. We knew that there were areas, zip codes, regions of our county where the highest COVID-19 cases and the lowest vaccination rate are happening and were expected to happen. They include East San Jose, South County, members of our community that are of African ancestry, African Americans, and the Latinx community. So we needed a lot of information in all the languages, or as many as we could, in addition to the language line, Spanish, English, Vietnamese, Chinese, and Tagalog for the Filipino speaking persons. The next one. This is just a graphic of how something that sounds as easy, let's say helping somebody get an appointment slot, a resident from a highly infected community, how many people need to be available to help with that? Well, there needs to be several, it has to be in several languages. It has to have paper, educational material if it's available and needed. You have to help the people review the eligibility criteria. What are the available locations they could go to? Make it easy and apply filters so that they don't get so many results, they're overwhelmed. Navigate for them. Confirm an appointment at the end if they are willing to do that over the phone. And then take down all the patient information so that when they go and get to the vaccine site, they will have a record already and it could go as a smoother activity. The next one. We work with many resources and advertisements that were in all those languages that I mentioned, try to make them visible and available. Testing, also to continue to encourage testing for the disease and what you need to know. The next one. Vaccine testimonials from members of the community that are well respected and well known, that could share their stories about getting vaccinated, because I think that we all identify with somebody who looks like us, who wants to tell us that they went through it, had a vaccine, and are one more member of the team, if you want, that can attest that you might have some symptoms after the second vaccine, but those symptoms are in no way worse or more worrisome than the opportunity of facing COVID-19 illness, especially if you have a comorbidity, if you're older, or if you live with somebody who you can transmit it to and who's not going to fare well if you get infected with this disease. I think that that is one of the most heart-wrenching parts of this, that maybe the young people think that it's not going to happen to them. And right now in the United States and in California, it is really the young people that are driving still the cases that remain. And so we need to all do our parts. The next one. We also have, I mentioned several times, the website. The website in Santa Clara County clearly says that anybody 16 and over can get a vaccine, that you can navigate it, that if you need help navigating, you can get assistance by phone. And the next one, you also can have the vaccine website in those 5 different languages that you see there, a multilingual phone line, and direct links to schedule appointments also in 4 languages. The next one. So from all of those efforts, we learned where would be the vaccination clinics. Some of them, as you know, are set. They are, I will have a list at the end of my talk, but some of them are roving. They move from different locations. They need to have an agreement from the persons owning the space. Sometimes it's in a parking lot. It has to be handicap accessible. We need to, if we vaccinate one group of people, then we need to make sure that we have a plan how to get them the second vaccine, because you can't take an intervention that is not complete. The intervention really counts when you have the two vaccines, and takes a lot of canvassing and partner network to be able to have a roving COVID-19 vaccination clinic. And then lastly, in terms of the vaccination modalities, with the next slide, is what we is the mobile vaccination. This is when a big group of nurses go out to the vaccinations locations. We've done this with the congregate settings, started with the skilled nursing facilities, and now with the assisted living facilities, even as small at the boarding cares that are 6 people big. Mobile vaccination just, again, seems like a no-brainer. Why wouldn't the vaccine come to you? Well, it turns out that this vaccine is complicated to store, complicated to move. You might have heard in the news that Pfizer and Moderna, they have to keep at a certain temperature, not even the normal refrigerators, but actually -70, which is an ultra refrigerator. So the vaccines don't get out of the refrigerator until they are going to be delivered. And if you have a mobile vaccine, if you're going to go to different areas, you have to plan so that you go to the areas together, so the vaccine is not outside of refrigeration for longer than it needs to be, and so that it actually gets all used up. It is very complicated because sometimes numbers, when you get to a site, a mobile site, they don't correspond to what you plan for. They have to be flexible and act quickly. In the next one, we not just us, but also the pharmacies, Walgreens and CVS in Santa Clara, partnered with the federal program, and they also did mobile vaccination clinics going into the skilled nursing facilities and long-term care facilities. But the model of mobile vaccination remains in Santa Clara now that we've accomplished that goal, and now we're going into specific adult home settings, very resource intensive to vaccinate somebody in their own home compared to when you can have a big clinic and have people come to you, but it's needed and we're going to do it. The next one, the county vaccine clinics are all listed there with their times when they're open and the number of people that they can handle in a single day. The Expo, which is the oldest of all the clinics, is more than 2,000 a day can go and get vaccinated there. Some of them started as only drive-through and then they converted into also walk-through. I think Levi Stadium, it was one of those, can also handle 2,000 people a day. And then they're smaller, but by smaller we mean 400, 800 people a day safely, so that they don't aggregate and there's no transmission in the sites, but you get the objective of delivering the vaccination first and second. The next one, there's also clinics that are associated with the Gardner Family Networks, with Roots Community Clinic, with the AACI, the Bay Area Community Clinic, Northeast Medical Services for the Asian community, Ravenswood Indian Health Center, and smaller partner clinics. So how did we do with all of this and how are still doing? The next one, how close are we to the goal? The total Santa Clara County population age 16 and older is 1.5 million. And as of May 2020, Santa Clara County has administered 1,153,936 first doses. Now, very encouraging, but we do have to remember that one dose is one dose, and the full vaccination series is 2 doses, and we still have a ways to go. And with anything that you do, including a vaccination campaign, the more you get to the hard to reach, more hesitant populations, the more difficult it is and the more resources you have to spend for delivering one vaccination. The next one. This is how we're doing in terms of in age 16 to 49 on the left side of your screen, and on the right side, 50 and above. The colors mean the race ethnicities and their vaccination rates. As you can tell, leading the pack, 89% vaccination rate for the Asian community, somewhere in the middle, 50% for white, and then less than 40% for Hispanics. Is the same, more dramatic in younger adults, less than 49, than in older adults, more than 50, which is on the right side of your screen, where the vaccination rate is higher. Of course, they were the first to be eligible for vaccination, 65 and above, 75 and above, but still there are disparities, and they are less evident in the older people. So there's also a suggestion that the younger people have different reasons to not want to vaccinate it. And those are the ones that now we have to be very aware of. The next one, these are the actual numbers of 16 and above receiving at least one dose, 71.7%. That's an incredible amount. And congratulations for all the people that has helped with this effort that are listening now. Let's keep working. Let's not be complacent. Let's know that not every Santa Clara County resident is part of that 70%. That if you're Hispanic or Latino, less than 50%. And however, the cases still continue to happen in our population. The young people need to start getting vaccinated, and in the older groups, we're doing quite well. And a testament to this is that in the skilled nursing facilities and assisted living facilities, we have had almost 0 outbreaks of any significant size with transmission in except for a few cases here and there that don't really create a big spike, and a lot of deaths in the residents of the long-term care facilities since February. The next one. This is by age. We already saw that when we saw it by race ethnicity, so we're going to skip over. This is our dashboard where you can go and keep track of these numbers. Nearly 1.2 million doses delivered, and men, women, race, ethnicity. You can look all this up in the Santa Clara webpage. The next one, the next hurdle, in addition to the young adults, is that soon vaccination will open for those 12 to 15 years old. So all of you listening with teenagers, there's 100,000 at least in our community, and they will also need to be vaccinated. So schools, pediatricians, family practices, and others will need to become part of the effort. The next one. I wanted to thank the many partners that Santa Clara County has had. in the community, and we know that you're also working very hard, and we appreciate your help. The next one. And so our goal, my last message here, is that we need to continue ensuring equity in vaccination and healthcare access, and that ensuring this equity can only be done through sustained and multifaceted efforts. We're all part of the community. The county public health department is bringing the vaccine to the sites where it needs it. We need to show up to the vaccination sites, get our vaccines, return for the second one, and have our families and our communities and our friends and neighbors do the same, because we need to do it together. I now have time for questions, and I apologize for those that have been waiting with their questions, but I'll be happy to try to address them.
Thank you so much, Dr. Villarino. That was a very enlightening presentation. We have in the audience, just so you know, our Chancellor of our Foothill Community College District, board members, as well as faculty and staff. So these questions are coming from a whole array of different people here. The first question that I want to ask about is the authorization for the of the vaccine for the 12 to 15 age group, which apparently did come out today. And so this person would like to ask what your thoughts are on this, and do you think this will have a large effect in the goal towards herd immunity for Santa Clara County? And I also feel like many parents are skeptical or believe that young adults, kids are at low risk for COVID. And what would be the best way to convince parents to vaccinate their kids in this age group?
I think I'll start with the end of the question. All age groups matter for the herd immunity and vaccination efforts. Children can get severe forms of disease. It is not as common, but it is not unheard of. Anybody who has had a child lost to a preventable disease would be better to speak about this than myself. There's been the youngest age of a case that we had in Santa Clara County happened not so long ago, 6 months old. I think that we need the help primarily of the parents. The pediatricians can help, the schools by promoting practices that say, to come back in person is better if you're vaccinated. That has been the same case for all the vaccines. We don't live in this community by ourselves. We cannot not think of the greater community benefit that vaccine does. We don't know more by doing investigation on the internet. There's always going to be people that are doubters or that believe they have other sources of evidence. I'm not saying don't consult, don't make your own research, but look at where the source is from. Consult from experts. We have UCSF just up the road. We have Stanford. We have Santa Clara County that can tell you the statistics, that can show you how the numbers of cases are going down, and can tell you how many children have had COVID, and that COVID is transmitted by children to adults. Not that common, but we have had, including with some of the new variants. A young boy 13 years old, that got infected at home through an exposure, the older brother, friend, and then went to school and transmitted to the teacher, and then the teacher transmitted back at home. So yes, it is a very important group. And thank you for sharing the news that it has been approved today. And I'm sorry to have outdated information on my slide.
Thank you. I mean, some of our audiences are on the internet looking for this kind of stuff all the time. One person asks that I am confused about the use of the term natural immunity, considering that there isn't strong data of natural immunity offering protection against COVID, especially the most common variants. Could you elaborate on this?
Yes, immunology is a very complex science. I can call it natural immunity, and more correctly, I should have said convalescent immunity or post-infection immunity. That's what it means. It means that after you already had an infection, you have developed antibodies specific for that virus. And if you get that virus again, which can happen, your antibody production will get going much faster than it did the first time around. So the first time around that you got infected, you created antibodies, sometimes not enough antibodies, sometimes not fast enough. And some of you might have gotten treatment with what is called monoclonal antibody infusion, which is direct. At the beginning, we even had convalescent plasma from donors that were recovered from the vaccine, but this is precisely the answer to the natural immunity. When they went to look for the convalescent plasma donors, they could tell that somebody who's had infection only a month ago still didn't have enough already antibodies to be able to be worth it to harvest their blood and give it to somebody else. Whereas somebody who could have gotten infection 6 months ago could still have very high titers of antibodies and be, so that was not a reliable source. You couldn't have a reliable source of donors. So then again, through the mRNA technology, being able to create a treatment such as monoclonal antibodies was truly one of the great advantages of science that gave us an understanding on how this works. So long answer to say, natural immunity is not perfect in any disease. There's very few diseases. Some of the viral diseases, for example, you never do get again. And why wouldn't you? But for example, measles is in an adult, very dangerous. Measles in a young child, very dangerous. If you survive the first episode of measles and you're okay, or measles for an unborn baby, very dangerous. You need vaccination, no matter what. There's no amount of natural immunity for measles that would protect you. COVID is the same thing. You need vaccination.
Okay, thank you. Another person asks, earlier in the pandemic, I remember Dr. Sarah Cody saying, just because something is open and available doesn't mean that it is safe, as in like places that are open and available. The rules are changing for folks who are fully vaccinated. I know that restaurants and gyms and the like are open and available, but are they safe if you are fully vaccinated?
They're safer than if you're not fully vaccinated. They're safer if you keep your distance from other people. If other people, let's say your instructor or your server, wears a mask, they are opening up. There's no guarantee of perfect safety. It is a matter of a personal choice to a certain degree, what amount of risk you're able to live with. As long as there's virus circulating in Santa Clara County and in our state. No one place that is outside your home is safe 100%. But the reality is that you do have to have enough people infected and coming into contact with you to maintain the chain of transmission. The less people infected that are out there and that you, by probabilities, are able to meet in any of these things that you do, going to a restaurant or going to the gym, the less people that we are in a community that are infectious, then the less probability that we all have. So when the county allows, when we open up more fully, still make the same common sense behavioral changes that you would do. Go early, don't stay long. Bars, not a good idea. Bars are, and I don't have anything against the business. I hope that bars survive, that places of gathering survive, but it's not a good idea to do it now. It's not a good, there's some things that are not essential for life, that you can do it later and maybe stay away from those places.
Thank you. We only have a couple of minutes left, so I wanted to ask a little bit of a selfish question from our college district perspective. We are looking towards the fall quarter and how we need to open the college back up again for students on campus instruction safely. So would you have any advice, recommendations for us as we consider these points of view and have these conversations?
Yes, it is hard to strike the right tone. I think that, of course, vaccination. The vaccination of the teachers, vaccination of the students, vaccination of the service workers that are in the campus. I know that part of the series is sponsored by STEM. So I think that no one in 2021 is the same as they were in 2019. No one not knows about a little bit of epidemiology, a little bit about infectious diseases, infectious disease transmission, and also read up on the wonders of the vaccine. How this intervention is really what makes it able for us to be safe and to start school. In-person teaching, to me, is essential. There's a lot of loss by not having students attend in person. And I think that vaccination.
Thank you, Dr. Villarino. I saw that in one of the slides you had talked about the various places where you could, where there were vaccine clinics that could be, that you had set up. We hope one not too long from now, you can add Foothill College to that list, because we are working with Walgreens as well to set up a vaccine clinic here on our campus in less than 2 weeks, hopefully. So just to let you know, and take this opportunity to really thank you for your time, and thanks for all this valuable information that you have shared with us. And I hope maybe someday in the future you can still come back and share some more of this with us.
Thank you, and I'm sorry their questions might have gotten cut short a little bit. If you want to send me any other question, I will be happy to address them on a chat. And please, anytime, it's my honor and to represent Santa Clara County and to partner with you in this important seminar series.
Thank you very much.
Have a good evening, everybody.
Thank you.